Hey, I'm Diane. My posterior laminectomy with fusion surgery on my neck on a vertebrae levels C4 through C7 was done exactly 2 weeks ago today, and I just wanted to give a little update as to how things are going with all my progress since the surgery. So my surgery was done by a neurosurgeon on a Wednesday, and I was discharged from the hospital on a Sunday afternoon. Before being discharged, my pain was able to be controlled by the use of just prescription medication. I had been using a morphine pump for the first couple of days when I was out of surgery, but and definitely it was my best friend over that time, but I was able to sort of reduce my dependency on that and just be able to be discharged from the hospital with the use of some prescription medications that, you know, will change over time as well. I also had a few sessions of physical and occupational therapy in the hospital before I was discharged, just to help you learn to do some basic things and really raise your confidence level. Before the surgery, I was pretty wobbly, falling down a lot, so just having some insights as to do things of like how to do the best on steps, how to get in and out of a car more safely with your neck in whatever precarious position it might be in, or how to safely get out of bed from a lying down position. Just helps to raise your confidence, and I'm thankful that that was also part of my care while I was there. Before the surgery, my symptoms had progressed pretty rapidly, and I was tasked with wearing an aspen hard collar just for protection. But since the surgery, my surgeon is part of the camp that thinks that not wearing a collar actually helps you to gain more strength more readily. So I have not worn the hard collar at all since I've been home. I've worn a soft collar when I've been riding in a car, and just when I've needed to have just a little rest for my neck, that I've just put that on sporadically, but I really haven't been wearing it very much at all. I have a lot of respect for those of you that are in the camp that you have to wear a collar after the surgery. My patients would absolutely be tested, so wow, I'm happy that I'm in this camp. When I was discharged from the hospital, I live alone, so a dear friend came and stayed with me for about a week when I was first out of the hospital, and trust me, you will not be able to do things alone. Very much dependent on her help with, you know, just basic things of getting around, just for me to be able to deal with things safely. And, you know, I just slept a lot too. So she was able just to handle some of the things you have to do. And I'm really appreciative for that, but don't plan on ever doing this alone when you get out of the hospital for that first week. It's just not anything you can do. Sleeping was a bit of a challenge for me when I first got home. I really depended on the use of a zero gravity chair, and I really recommend that you have one of them available. I know a recliner could do just about the same thing, but the zero gravity chair is great that you can find that exact right angle that is the least painful, and you can just kind of recline in that position. And I just wrapped up in a blanket, and that's basically how I slept until just a couple days ago, that I've tried sleeping in my bed again, and it's gone okay. I think I really need to find some new pillow options from what I have. But I am starting to just sleep in bed again, but I still have that zero gravity chair at the ready, so I need to just get back into that just for pain issues. Also, what are some things that I found very helpful? Bendy straws. No matter how you drink, you're not going to do well, or even if you're not wearing a collar. And it's a challenge with eating too, that you don't realize how you sort of like jut your neck out as you're taking a bite. So you just have to learn some new ways to do things, and your flexibility returns in some decent time in doing that. I also purchased a grabber off of Amazon. Still tending to drop a lot of things, and so that's helpful that you don't have to keep bending down when things hit the floor, and it's just easier for you to pick things up in that regard. My incision is healing pretty nicely. I had a new dressing put on it the day that I was discharged from the hospital, and honestly, it just sort of sloughed off over a couple days too, and just, you know, had a new bandage put on. But my first post-op visit was at the end of that first week that I was at home, and he just took the bandage off at that point, and I have not been wearing a bandage on it at all since that time, and things seem to be healing up pretty nicely with that, so I'm pleased with that. So at this point, I've been able to stop taking the oxycodone that I was prescribed, and I'm really just depending on use of Tylenol and Advil, and a muscle relaxer. I know not everybody can do that, but I just, for how the other things that oxycodone makes you feel, I just made that decision to just sort of do what I could to wean my way off of that in a safe fashion pretty early on. I'm pleased that seeing some pre-surgery symptoms improving already. My balance is starting to improve, and that I really had a terrible burning pain in both of my hands prior to the surgery, and that has really reduced. It's not completely gone, but it's really reduced. Though I'm finding my hands to feel more numb now, and you know, that's just a change since the surgery. So I just have to keep in mind that recovering from this type of surgery is a marathon, not a sprint. Things will take time. I've heard several people that are familiar with this type of surgery, including my own surgeon, saying that it can take up to 18 months, a year and a half, before all the things that this surgery can accomplish by taking that stress and pressure off of your spinal cord is really done. So you just have to be patient to see things change. Some things might get worse before they get better, but it's just going to take time for really things to change with that. Patience is a virtue with everything, but especially with recovering from the surgery. So I'm pleased with how things are progressing. I will be starting to work from home in a couple weeks. I have mostly a desk job, so I can do that, and then hopefully within, you know, not too long a time, be able to return to work on at least a part-time basis and sort of just ease my way back in, but realizing that you're just tired, your body is developing a whole new way of working after the surgery, and so you have to give it the time that it needs. So I'm sure everybody handles the surgery differently. Everybody makes different choices as to whether it's a neurosurgeon or orthosurgeon, and every surgeon has different recommendations that they make after the surgery as well. So my experience will not be exactly like yours, but just want to give you some hope. Things are going well for me, and I'm pleased with the progress that I'm seeing, and may your surgery go just as well.